There's Dr. Len Rodberg, Joel Tiny Man on the Street Reporter. What's all the fuss about? You wonder? Well, Len is going to explain it to us all. Prentissimo. We're here at the Family Partnership Center cafeteria. Len, why are you all the way here up from New York City today?
Well, everybody knows that we've got a serious problem, and all of us have a problem in getting access to health care. It costs too much. It's too complicated. When you want to see a doctor, you should be able to see a doctor without having to pull out your wallet and prove you have the money. And basically, I'm going to show what the solution is. Every other country in this world has figured out how to do it. It's about time we did, and let's start here in New York, and I'll show you how we can do it.
How much would it save if we did this in New York State?
We'd save $45 billion a year in New York State. That's a lot of money. That's about $2,000 for every person in this state. We would save serious money and be able to boost the economy and get access to health care at the same time if we're smart about it. At the moment, we're just stupid in the way we pay for health care, and let's get smart and the New York Health Act is what it's all about, and I'll explain it and how it will, in fact, solve the problem that we all face in getting access to health care.
How does that work that we can cover everybody with serious comprehensive health care while saving tens of billions of dollars annually? How does that work?
Well, we waste so much money on the insurance system. We don't need the complicated multi-payer insurance system that we have that wastes about 20 to 30 cents out of every dollar gets wasted on the billing system. Other countries don't have complicated billing systems like that. What they have is healthcare. And we know how to do this. We can, when we Americans go out and show other countries how to do it, but we can't seem to show ourselves how to do it. Here in New York, we are smart enough to be able to figure it out, and we will save money, both in doctors' offices, in hospitals. Of course, we won't have private insurance companies. We'll have a state fund that will pay for health care. And just like Medicare, just like the VA, we'll all get access to health care without having to empty our wallets and go bankrupt, as many people do.
Is it true that you not only wrote the national health care legislation for former Congressman Ron Dellums over 40 years ago, you were the first member for Physicians for a National Health Plan?
That's right. That's right. I helped found Physicians. I'm not a physician, but I know a lot of physicians. I've been married to a physician for a long time, and I helped found Physicians for a National Health Program, which is the leading national organization advocating a single-payer national health insurance program for this country. Given the Congress we have right now, we're not going to get it in Washington, but we think we can get it here in New York State, and that's what I want to talk about.
Can you give us the two websites for PNHP and the New York Healthcare Campaign?
Sure. The Campaign for New York Health, which on whose board I sit, the website is NYH Campaign. That NYH, New York Health, nyhcampaign.org, .org, and our PNHP chapter, Physicians for a National Health Program chapter, that does a lot of the writing and analysis for this bill and for Assemblyman Gottfried and Senator Rivera, who are the sponsors, is pnhpnymetro.org.